Hey, good morning. My name is Cherryl Li, and I am a clinical or biomedical engineer working for Island Health here on the west coast of Canada. However, today I'll be talking about some of the work I did with applying the MERS system to capital planning during my time as a clinical engineer with the government of the Northwest Territories. So before I begin, I want to highlight that I could not have accomplished all of this great work without the generous support from my team, and that includes Shauna Mullally, who is the lead of health technology planning in the Northwest Territories, as well as Kevin Taylor, who is the director of biomedical engineering, again, of the Northwest Territories. Kevin is also one of the two original authors of the MERS system paper that was published in the Journal of Clinical Engineering back in 2005. So to start, I want to provide some geographical context of Northern Canada. So as you can see on the slide here, the Northwest Territories is an Indigenous territory located in Northern Canada and extends for more than 1,300 square kilometers. It is the most populous region of the three Northern Territories of Canada, with a population of approximately 42,000 people. Half of this population lives in the capital city of Yellowknife, also shown here, and this also houses the largest hospital in the region. Not pictured are also hospitals in Inuvik and Hay River, as well as many health centers and health cabins distributed throughout the territory. Now, health technology planning works alongside biomedical engineering to manage, service, and replace medical equipment in the north. Earlier this year, there were approximately 6,400 assets valued at approximately 61 million Canadian dollars. Perhaps to some of you, these numbers may not seem very large, especially given the larger jurisdictions of Canada or even throughout the rest of the world. However, keep in mind that these devices are sporadically distributed throughout the territory, and there are logistical challenges to ensuring the timely maintenance and replacement of these health technologies. Furthermore, the number of health technology assets in the jurisdiction is not directly correlated to its impact or priority to service. For example, should a defibrillator fail in a remote northern health center, there are significant impacts to programming to ensure that this patient receives the care that they need. On top of our logistical challenges with our sparse population over our large geographical area, there are also other northern specific challenges with equipment planning in the north. For example, temperature extremes are common with our large climate variant from the north to the south. In the summers, we can see highs of 36 degrees Celsius, but winters can regularly approach below -40 degrees Celsius. Limited staff knowledge due to our constantly changing clinical workforce is also another ongoing challenge we face. And because some of our health centers and health cabins are located in remote communities, these are only accessible by plane or by ice road in the winter months, and limited internet access in these areas can lead to challenges with data collection or data availability. Now, given the criticality of health technology management in the remote Northwest Territories, our team indicated a need to prioritize the replacement of our technologies using a robust evidence-based approach. Ultimately, the system will benefit health technology planners, biomedical or clinical engineers, as well as clinical leadership so that we can work together to better plan for and manage the future of medical equipment such that our patients can receive more effective and more safe healthcare. That brings me to today's topic, and that is the Medical Equipment Replacement Score, or MERS system. So again, based upon the original study published in 2005, Kevin and I collaborated to refine the MERS system to our current everyday needs. So as you can see here, the MERS system is actually an equation designed to allow us to quantify the qualitative factors behind the medical equipment replacement decision-making process. The scoring system itself consists of three main components. That is the technical, device safety, and mission critical score. And these scores are broken down into subcomponents that altogether sum up into a singular MERS score. So every medical device or asset will receive a single MERS score, and assets with higher scores will receive higher priority for replacement. If we go through each score and break it down to its subcomponents, you'll see that the technical score on the left here is made up of the physical condition of the device, the age versus its lifespan, and its discontinuation multiplier, which indicates whether vendor support is available for a device or not. The device safety component consists of the physical risk subcomponent, which evaluates the risk to patient or user should the device fail or malfunction, and the technology-related incident multiplier, which allows us to indicate whether an incident or documented hazard alert exists for the device in question. Finally, the mission critical component allows us to define the value of a technology depending on the services of a health system or institution. The mission criticality subcomponent defines the impact of the device to service, and the backup multiplier indicates whether a facility or regional backup exists. Again, all of these components and their respective subcomponents are aggregated into a singular MERS score so that we can assess the replacement of any medical device. This refined MERS scoring system was then programmed into the appropriately titled MERS assessment tool, and this was done using Microsoft Access and Excel. Our existing biomedical equipment database uses proprietary software. So data is extracted from the software and moved into Microsoft Access so that we can assess every medical device or asset and assign it a prioritized MERS score. So as you can see here, users from biomed or health technology planning can use this MERS assessment tool and look at the MERS score of devices from a holistic level, so by jurisdiction or by health authority. But users also have the ability to parse down to the granular level and look at devices from a specific facility or a department in that facility, or even a specific device in a facility. These results can then be exported directly to a PDF format or to an Excel format for further data manipulation. Additionally, users also have the ability to sort the results based on the capital grouping of device for budgetary purposes. So rather than looking only at the MERS score, there is a specific option for users to select called the capital projection option so that users can assess further capital requirements in further detail. When users select the capital projection option, they are presented with an Excel sheet shown very similarly to what you see here. So in the left-hand column, you'll see that devices have been grouped by the capital budget or by its technology grouping, so what procurement strategy would fall under. And then in the right-hand columns, it depicts the amount of funding needed to replace equipment at the end of its risk-adjusted lifespan. For example, if we look at the large capital equipment row, the second row from the top, this could be digital X-ray machine, MRI, CT scanners, anything that costs quite a bit of money. You'll see that there is capital required to replace this equipment in 2021 and 2022, but the cell in 2023 is blank. That's because no equipment needs to be replaced that year, so no funding is required for 2023. Additionally, while this sheet only depicts the next 10 years, there is a second page that indicates additional funding for another 10 years, so from 2031 all the way to 2040. Note that the data presented here has factored in the risk-adjusted lifespan of all equipment so that we can achieve a balance between budgetary constraints and clinical program requirements to support the governmental capital planning process. Earlier this year, this capital projection tool was used to form the basis of our next 5-year capital funding projection for health technology management. And these projections are in the process of being reviewed by our territorial government. In summary, the MERS system was refined and programmed into a tool using Microsoft Access to allow users to outline medical equipment replacement priorities over the next 20 years. This facilitates an organized approach to health technology management given the limited capital funding and our Northern-specific challenges, and allows users to ultimately better address medical technology needs and future system development. Thank you all for listening. If you have any questions or comments, please reach out to me at the email shown. Thanks again.